In need of health insurance? Great news. The deadline to get yourself covered has been extended until August. What if you're 65 years old? Well, it's time for Medicare, but maybe you need help taking care of that. We have experts to help you navigate the process. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. They're all here to answer your questions. We've got 3 experts, so we're going to be able to answer your questions on healthcare. If you have a question, the way you get it to one of these experts is to text us 336-379-5775. Remember, this is text only, so please do not call. All right, first and foremost, our very first question, Laura, this one's for you. It says, what is the deadline to enroll in the ACA plan?
The new deadline is August 15th, but there's no reason to wait. The new numbers are already on healthcare.gov, so you can go there today and find out how much you'll save.
Okay, and so one of the ways to do that is to go to ACA, right, .gov, be able to look at all of the plans, and that may just make you want to go, oh no, this is like way too confusing. So if that is the case, that is where Morgan comes in. She is an independent insurance agent. That doesn't mean that she gets the money for signing you up. So we want to make sure that you know that it is a free service. But Morgan, how does an insurance agent help?
So what we can do is look at the plan, we can look at the network, we can look at the medications that are in each plan's formulary and figure out what plan is best going to fit your needs. If your physician is with Novant, then you're not going to want to select a plan that is just with a network of only Wake Forest Baptist, because you're going to have to give up your primary care physician and you're not going to be happy and you're not going to have a pleasant experience with that.
All right, and sometimes you just need a little bit of help in figuring out what is the best plan for you and your family, so don't be afraid to be able to do that. All right, speaking of which, don't be afraid to ask questions. Catherine, we're going to put you on the spot now because everybody always asks the question, I'm turning 65, do I really have to apply for Medicare?
Absolutely, and you have to do it within the window that we give you, which is 3 months before your 65th birthday, the month of your birthday, and 3 months after. If you miss that deadline, you're at risk for having to pay a premium forever afterwards. So you want to go on, you want to sign up. And if you're still working and you have an employer, you need to go and talk with your benefits folks, because there are a lot of criteria for what you could do during that period if you wanted to think about keeping your other insurance. So absolutely, just see that as a red letter day for you.
Absolutely, sign up. Okay, so the next question, Laura, this person is asking, if I enrolled before August 15th, will I need to re-enroll next year?
Yes, the normal open enrollment period is November 1st to December 15th for next year. And we don't know yet if the administration is going to change that period at all, but at least for now, it's November 1st to December 15th. So if you're enrolling now, it's for this year. And at the end of the year, you'll need to enroll again.
Okay. Morgan, this person is asking, what if I plan to move to a different state in 2 months? Do I have to re-enroll?
So that's a very easy process. If you have an account on healthcare.gov, you simply go in, report a life change. There you're going to change your address, and the system is automatically going to pick that up. And when you get to the end of your application and have your eligibility notice at the end, then you're going to be able to select plans that are available in that state.
Oh, okay. So then you'll be able to know already which one you want to do. All right, smart.
Correct.
All right, Catherine, this person is asking, do most people drop their regular insurance once they're enrolled in Medicare?
I think most people drop their health care insurance if they have an employer, or many of them do, but they look for a Medigap plan to pay for the balance between what Medicare covers and what the true cost of their care is. So again, it's just so important that you, if you're working, look at whether or not that insurance is better left intact or becomes your Medigap insurance.
Mm-hmm. And there is no harm in asking 1,000,001 questions to everyone about this.
No, and when you go on the Social Security website, you can read all of that, and then you'll have 1,000,001 more questions. So get help rather than guess.
And AARP can help with that?
AARP, if you go to www.aarp.org/Medicare, there's a lot of just basic information there that helps you to learn the vocabulary and figure out what's going on.
Okay. All right, we're going to continue to take your text questions. We've got one more segment coming up. This is how you get those questions to these experts, 336-379-5775. We'll be right back.